talk about. We're going to talk about Ignatian leadership, Ignatian values, and Ignatian pedagogy. And then we're going to put that together as residents, as teachers. So that's kind of my goal here. Okay, so how is an Ignatian leader different from other leaders? Here we have our governor, Katie Hobbs, came over to our building. We got to try and teach her a few things. And our president, Father Hendrickson, there on the right. What does make an Ignatian leader different? And here's two quotes that I found that I really like, and I kind of highlighted the parts that I like. This first quote, it is a disposition of mind, heart, and will. I like that. I think that describes an Ignatian leader. The second one is an invitation to act in a way that reflects our most deeply held beliefs, affirms our vocation, and serves others, particularly those in need. That is really what differentiates, in my mind, someone who is an Ignatian type leader or a Creighton leader. And that idea of, does your actions reflect what you feel inside, right? Does it reflect your values and your mission and your vision? And I think that's critical to being this type of leader. So what are the values? And I wanted to show you the values, right? These are the traditional Ignatian values, finding God in all things. Now, some people get all uncomfortable when we start talking about God. I have found that the Jesuits are incredibly welcoming to all people of faith. So whatever your concept of God is, however you show that faith, we want you to join us. You're part of us. That is who we are. And so I'm not Catholic, and I feel like I fit in this organization. I am a person of faith. And so I just feel welcome here. And I hope you feel the same. Whatever your faith system is, whatever your belief in God is, we want that. We want people of faith. And once again, that one that we defined a minute ago, unity of mind and heart. Number 3 is cura personalis. Who can define that? Anybody define that for me? Cura, it's a Latin term. What's that? Better of people. It has to do with people. Personalis, personal, right? Cura, the curing of people. It really means care for the whole person, body, mind, and spirit. The idea that health isn't just a physical thing. It also involves our mind and even our spirit. And we want to approach all aspects of health, not just the physical aspect. I really like that term. In fact, I had my cura personalis moment. I'll bore you with a story. I have an African-American friend, and sometimes he feels like when he goes to the hospital, he doesn't get the same care other people get. He worries about that. And I told him, I said, hey, if you ever feel that way, give me a call. I'll come down and I'll make sure you're getting the care you need to be getting. And he called me. It was like a couple of years ago. He called me and he said, I'm here with his wife actually called me and said, you know, he's writhing in pain. He can't urinate. He had a really bad prostatitis. It wasn't at one of our hospitals. I don't want to disparage any other hospital, but it was Banner. And and so I went down there. I'm a radiologist, right? What do I know about, practicing medicine? But I went down there and I came into the room and I did have a badge on, and this nurse is like typing calmly at her station there, right beside him. He's on the bed, writhing in pain. And his wife's there, and she's been telling him the whole time, you wait till Dr. Richardson gets here. He's going to set you guys straight. I mean, I don't know any of these people. I don't even have credentialing at this hospital. They don't know who I am, right? I walk in there and she kind of looks at me and says, who are you? I said, well, I'm a friend of theirs, Dr. Richardson. I'm a radiologist. She says, all right. She turns around and keeps typing. And I look at her, and on her arm, she has tattooed cura personalis. No kidding, she does. And I looked twice to make sure. I was like, excuse me, any chance you went to a Jesuit university? And she stopped. She turned around. She said, how did you know that? I said, well, you have tattooed on your arm, cura personalis. I'm the dean for a school of medicine here for Creighton. And that's what we teach our students, is care for the whole person. She said, yeah, care for the whole person, body, mind, and spirit. And I guarantee she was way more attentive to my friend after that than before. It was a great, I call it my cura personalis moment. He got great care, I think. But that's this idea of cura personalis. Magis is another Latin term. It actually is translated as the more, striving, and more can be interpreted a lot of things. It doesn't really mean do more. You know, you're already busy, so do more. No, that's not what we're saying. It's do more with what you have. It's striving for excellence, and I think that's a good term and one of our values. I love number 5, men and women for and with others. As we're reaching out to help others, we don't just do it individually, we do it as a team. And we do it together, men and women for and with others. Faith that does justice is a very Jesuit term. When you hear that, that is very Jesuit. We don't just have faith, we have faith that does justice to our community and to others. Ad majorem de gloriam, to the greater glory of God, going back to number 1. And then the number 8, this idea of reflection. You know, St. Ignatius taught this 500 years ago, that as you act and as you learn, you need to reflect on what you're doing, and it improves things. And I think there's lots of evidence out there that reflection is a very effective tool for improving whatever you're doing, either educationally or in industry or whatever it is. So if you come to me and you ask me what I'm most proud of as far as what we're doing at Creighton, I think it's what we're doing with St. Vincent de Paul. And I think you all get the sort of problem we have. People without insurance, where do they get their health care? Well, they go to the emergency department, right? So they wait so long with their diabetes that it's out of control. They show up at the emergency department, they get admitted to the hospital, and it's this cycle of terrible health care. I always say it's the worst possible health care at the highest possible price. You know, as a society, we're paying a ton of money to care for the uninsured in our society. And so what we did, and Dr. Anwar was really instrumental in doing this, as well as Tina Younger over at Valleywise, is funneling these patients to St. Vincent de Paul to get their health care, to get ongoing care, so they don't have this crisis care. That's just a cyclical, terrible health care. And so we have been incredibly successful at helping these people. It's all about readmission rate, and I'm sure you guys are well acquainted with readmission rates. But our readmission rate with St. Vincent de Paul is 2.9%, a high at-risk population that we are doing a great job. We're knocking it out of the park, right? We're better than people with insurance. And you think, well, how could you possibly be better than people with insurance? When you go to St. Vincent de Paul, you get a 1-hour appointment. When you guys go see your doctor, how much time do you get? 15, 90 seconds. It is not much, right? How much time you actually get with the physician talking to you and examining you is not much time. At St. Vincent de Paul, you get an hour. A student come in and talk to you, maybe a resident, an attending, and then right there, you can get your radiology needs, pharmacology, your pharmacy needs, you can get labs. They have a nutrition person there that works with people. And then you name the specialty, we have a specialty clinic there for them. They can get any kind of subspecialty care they need as well. And it really has been a very effective model in caring for those in need, caring for the uninsured in our society. If you have insurance, you can't go there, but I always say the best physicians I know work at St. Vincent de Paul. And that includes residents as well. I think many of the residents go and work at St. Vincent de Paul. It is really outstanding. How many have been over there? By raise of hand. We have some. It really is a beautiful facility, and it is well run by Dr. Anwar and his team. So if you ask me what I'm most proud of, I'm most proud of this. There's Dr. Younger and Dr. Anwar over at St. Vincent de Paul. You can kind of see inside the clinic there. So what are the effects of volunteering your time? You know, we talk a lot about wellness as physicians, and we traditionally do terrible, right? Highest rates of suicide, mental health challenges, et cetera, within our profession. How do we deal with it? Well, we have a party. We call that wellness. And I'm not trying to disparage retreats that we call them, that they're disguised as parties, but I don't think that's the best way to approach wellness. And I think there's good evidence out there that volunteering your time, going and helping someone else actually improves your own mental health and your own happiness. And there's lots of studies that show this. And I'm just citing one here, but many studies that show that wellness is tied to service. Now, if you're forced to serve, it doesn't really have the effect you want. And if you're doing it out of some ulterior motive, it really doesn't have the effect. But somebody who wants to go and help others, it really gains a lot from it, both physically, mentally, and emotionally. And if you're interested in a book, if you like listening to books, this is excellent. Two physicians wrote this book called Wonder Drug, and it's really the science of service. And it goes through all of the research on serving and how it helps you individually in lots of different ways. So if you like to listen to a book, I guarantee you won't be disappointed if you listen to this. And I don't get anything for this. You know, I'm not out trying to make money promoting this book, but I really enjoyed it. Okay, the idea of Ignatian pedagogy is another term that I think you hear not infrequently. It's a cycle of sort of having an experience, taking action based on what you learn, evaluating it, but also reflecting through the process on it to try and see how you can improve. And I think reflection has been shown to be incredibly effective at improving whatever we do. And here's kind of a definition for reflection. Reflection gives the brain an opportunity to pause amidst the chaos and tangle and sort through the observations and experiences, consider multiple possible interpretations, and create meaning. This meaning becomes learning, which can then inform future mindset and actions. Here's one study from GME. Critical reflection is a tool that can amplify learning in residents and fellows, increase productivity. I think there's lots of obvious ways that reflection helps us. But reflection is a very Jesuit sort of concept, been taught for 500 years, really quite effective. And my goal really is to start all meetings with some sort of reflection. So this is kind of a long reflection for all of you, but I think it is critical to improving, to step back and reflect on what you're doing. And many of you have those sorts of habits that you develop. Maybe it's prayer, meditation, other things that you do during the day, but I try and think of how you can incorporate that into teaching as well. One of our faculty said he starts his rounds with a reflection of some sort, a quote from someone, just to kind of center you a little bit in thinking what's most important here of what we're doing. I think when you do that, you care for people better. All right, Jesuit mission formation. If you're really interested in these concepts of Ignatian mission, values, this sort of thing, there are some other programs that you can do. You can get involved in this novice program, go and learn a little bit about Ignatian spirituality, Ignatian values, and this is an opportunity for you to learn some more. The Creighton Colleagues program, typically for faculty, but we would allow residents to do that if there was somebody really interested. And then the Ignatian Colleagues program is really a university level program where leaders from different universities are nominated by their presidents to go and participate in a broader program. I actually did that this last couple of years, this Ignatian Colleagues program. It was phenomenal. It might've been one of the best educational experiences I've ever had. They do a retreat, an immersion retreat where you go to a different country and find out how they care for the poor in their society. I went to El Salvador. It's incredible to see what they're doing and trying to do to deal with the huge problems that they have in their country. We did a silent retreat as part of this as well, so where you go and you're in silence for 7 days. That was wonderful, actually. I loved it. I really quite enjoyed the silent retreat. And you have a sort of a year-long curriculum that you go through. But some other opportunities for you to get involved in this idea of Jesuit formation. And I just wanted to make sure I took time with you all. You're part of Creighton. You are a Creighton residency program. And I want you to know what that means, right? I've tried to describe to you what that means in this brief presentation. Any questions about what I've talked about the mission of Creighton, about our values? Any questions out there? You're gonna have to listen to me again, but have you heard any of this familiar to anybody, or is this kind of the first time for a lot of people that you've heard these things? How many feel like first time I've ever heard anything like this? Nobody? Oh, that's good. That's good. For most of you, this is kind of old hat. You've heard this before. Where did you hear it? Let me just ask. Orientation? Who talked about it at orientation? Who did? I did? I don't think I did.
Yes.
Yeah.
Not this talk. Yeah. Okay, so a year ago, maybe we talked a little bit about it. I just want to make sure you know what it means to be part of Creighton. And then you start, and I think most of these values and the mission really resonate with most physicians. Probably Dr. Bodapalli said it best when talking about his own wellness. He says, my wellness does not come from going home early. It comes from taking a few extra moments with a patient to try and show compassion. And I think there's a lot of truth to that. Some people feel like, oh, as physicians, we got to stay back and not get involved in what's going on with patient care. That book that I mentioned, Wonder Drug, just the opposite. They prove over and over again just the opposite. The more you dive into it, actually, the better your own wellness. Showing compassion, showing that you care about people, serving others is the way to health and to wellness. And I hope you believe that. And I hope you go read that book. Anybody read it? Anybody listen to it? Please do. You'll love it. You won't be sorry. Okay, residents as teachers. This is the talk I gave last year. And I'm just going to review this because I know a lot of you have heard a lot of these concepts before, but I want to make sure that you guys know you are teachers. And I think there's our building. You guys have seen that before. I hope that first question is clear in your mind. We do consider you teachers for our students. We're going to have PA students starting here in the week. We're going to have medical students, obviously, that are all over. And we do consider residents as some of our best teachers, really. And we try and honor a resident from each department every year for your teaching of our students. We appreciate it. So that, that's probably the first thing I want to say to you is thank you. Thank you for what you're doing with our students. How are residents, doing as teachers? Do you know you're evaluated? And how are you evaluated? And I want to make sure you see those questions and you know how they're evaluating you. And how can we improve is an obvious question. I think it's not a secret. What would you estimate? How much of your teaching as a medical student came from residents? Was it, let's say, was it 10%? How many of you say at least 10% of your teaching, your clinical years came from residents? Raise your hand. Not that much, less, a lot more. Okay, 50%. How many of you say 50%? More? How about 60%, 80%? Interesting. But I think that's our point, is that residents are key piece for teaching of students. If those residents hadn't been around, you probably wouldn't have got the teaching that you received. And I think, in an RVU driven world, everybody cares about how we're going to get paid. I'm trying to think back. I mean, currently I do get paid to teach students. Before I took this job, I never got 1 cent for teaching a student, right? Never. And I think it's part of our responsibility to teach others, right? And so whether or not you get paid for it, that's to work out with whoever the powers that be, and people are trying to be fair. But just think about your own experience and then be willing to pay that forward now as residents when you have the ability to help others to learn. Yeah, a variety of reasons why people maybe don't think they know enough to teach. I always like to show this slide. This is a book I wrote. But where would you do best to learn, chest radiology? You're going to go to some super subspecialized book on congenital heart disease to learn about chest radiology? Of course not, right? Or are you going to go to chest radiology at residence band? Oh, that sounds like you could learn something, right? But I think you have a lot of practical information that can be really helpful to students. Sometimes you think you don't have anything to share. What they want to know is actually what you are learning right now. That's really what they want to know. And so be willing to teach and teach what you are learning now, because I think that is key information for them. So here's the questions that are going to be asked about you as you teach students. Feedback. Are you giving them feedback? Are you promoting independent learning? I always think that's a tricky one. Are you getting them to actively participate in what they're doing? Are you modeling effective patient care? this is a really important one. Are you creating and promoting a positive and learning environment? And I think that's critical. You know, our credentialing bodies do not look fondly on institutions where students don't think they have a positive learning environment. And then overall, are you an effective teacher? So that's what they're going to ask our students about you. You know, and here's, we can just talk a little briefly about some of these concepts, but feedback, a lot of students say they don't get feedback from you. Why might that be? Why do you think when you did give them feedback, why would they think they didn't get feedback is what I'm asking.
You didn't label it as feedback.
You got to say it's feedback. What did you say over there? Same thing.
Yeah.
Yeah, if you don't say it's feedback, they don't know it's feedback, right? And what is feedback supposed to be? Is it supposed to be subjective or objective? How many think it's supposed to be subjective? How many think it's supposed to be objective? How many don't want to vote? What is it? Go ahead, Kate. You do want both? Why? That's a pretty mature answer, actually. That really is quite mature to say I want both. I think most people would say they want objective, right? And I don't know, has anybody ever worked, have you guys worked with Heather Walker on feedback? Anybody done that? She is the master at feedback, and she has really helped our faculty to improve. She's helped me improve my feedback. And we did it around student history taking. So our first year that we were in existence over here with our first year group came through, you know, these guys were terrible at taking a history, right? I can't believe how bad it was. But what you had to do, it forced you not to be subjective in your assessment. It forced you not to go, that was terrible, right? What does that mean? How does that help anybody to say that was terrible, right? You had to be specific. You had to say, this is what you said. What do you think about that? And so throwing it back to them, not just judging what it was, they may have a very good reason. Like when Kay just said both, I was like, well, that's wrong. But it wasn't wrong. It was actually an incredibly mature answer that she gave. And I would have missed out on that if I hadn't asked a question back to her. I didn't really mean to do all that, but I think that's a good example of not judging immediately, but being objective about what you see and then having a conversation about it. And I think you'll discover a lot. You may discover that they just don't know, right? Which is okay too. But I think objectivity really enhances a discussion. And I think as somebody gives you feedback, you know, I think it does open it up. Well, why did you say it that way? Why did you walk in and say, hey, dude, how you doing? As your approach to a patient. Well, maybe they connected before they got there. Maybe there was a variety of reasons why they would approach it that way. But then you can have a conversation about it and then maybe give some suggestions on other ways or come up with suggestions together. It really is a wonderful thing. And I would urge you guys to get involved in this whole thing. Heather has a system of doing feedback that it becomes really easy. And I think a lot of us, as we start teaching students, we don't really want to give feedback, right? It's like a distasteful sort of thing that you have to do. And so you do it. But I think as you do it right, it actually becomes very engaging and you learn a lot yourself as well. Any questions about feedback? How could you get involved? If you want to do history, evaluating students doing history, you're welcome to come down and you can, I've talked about internally, I need to talk to Shri about the internists coming over and helping with that. Because I think that could be a nice opportunity for you guys to develop in you as a faculty member and how you give feedback. All right, that's enough on feedback, sorry. We talked about this and we're gonna skip forward to the next question, which is independent learning. How do you promote independent learning? Any thoughts out there? What do you do to promote independent learning? How has somebody helped you independently learn how to do that? let you dictate on your own. Okay. And I think that's a really good tool, right? You go say it and then we're going to go over it together. Yes.
Oh, I think as much as Bill, why don't you read up on that tonight and then like tell us about it tomorrow? At least it's forcing you to go think about what you just saw.
And I really like that approach, as long as you add that second piece to it. Because students hate when you say, it doesn't look like you read much, you know, or you need to read more. That's a real negative connotation, right? Hey, you're stupid, right? That's not what we want to do. But if you say, hey, why don't you go read this chapter and tomorrow let's have a conversation about this topic. That's a whole different game. And as long as you follow up on it, that's a very effective way to do it. I love that way. Any other thoughts on promoting independent learning?
I think when my seniors have asked me, like, what do you want to do? That also like doesn't put you on the spot in terms of like, they'll always help you manage the patient, but it will help you like try to develop that. I'll read it up to date. I'll try to search for it. It's kind of the same as like, you'll go read the chapter, just like a different way of saying it.
Yeah, allowing them to think through a process of what do they want to do to learn. I really think that's really effective, because it's really easy, almost like spoon feeding, to say, okay, read this chapter and tomorrow we'll follow up on it. But to ask that broader question of how do you want to approach this rotation and get as much as you can out of your internal medicine rotation? What kind of things do you want to do educationally to improve yourself? That's a very different question, and really tells you a lot about where they are as a learner, right? I have no idea. Well, why don't you just tell me what to do? Yeah, I think that's a great approach. Thank you. And I think that's a lot of the things we're going to say. Yeah, collaborate, involve pupils, encourage people to reflect on a plan in learning, learner diaries. Encourage self and peer editing before work is handled. Okay, some other ideas. Next question. Actively, yes. Oh,
That was from a while ago.
Oh, just kidding.
okay. So they can hear us okay over there? Thumbs up. All right. Oh. They're not clearly not listening. Wave your arms if you can hear me over there. Okay, there we go. Okay, encouraged to actively participate. I think I had a question on this. I took it out. Yeah, active participation is really going to be dependent on your different services, what they can do. Maybe less in radiology. Although I heard some actually getting them to actually dictate. I think that's a great idea. Surgery, get into a closed case. I don't know what they can do in surgery. You do have the knowledge donor program, right? Where they can't kill someone. Yeah, so that's good. Internal medicine, you guys you should be having them actively participate, right? What do you guys do? They have their own set of patients. They go see them, come back. I think everybody has a plan for getting your students to actively participate. Modeling. You have to realize you're being watched, right? Especially if they want to go into your field, they are watching you closely, right? And they will know. So I always say, I don't know. One of my professors that I really like told me once, he said, Randy, people will learn far more by you sharing mistakes you've made than sharing your successes. And I think that's powerful. I think when you don't know something, don't hide it from the student. Let them see what you do when you don't know something. That's a powerful way to learn, right? Wait a minute, you've never seen a dysplasia before, a bone dysplasia. What are you going to do? And them watching what you do to go figure out what kind of bone dysplasia this is really helpful, right? What's your approach for reading a CT? Do you have a pattern that you go through each time? Sharing those kinds of details is really helpful, and a wonderful opportunity for you to model how you do things. All right. You guys actually are really good at modeling, I think. Little ducklings. Yeah, there's a picture. I like to show this every year. Anybody caught halibut before? Anybody caught a halibut? Oh, we got some halibut. Tell us the process. What'd you do?
So these are deep sea fish up in the northwest, so you usually need to have like a lead ball weight to get your fishing line all the way down to the floor. They're ugly as all hell, and it's a decent fight because you got to pull them like 300 feet up. They're big too. They can be 60, 80 pounds. So.
That's a perfect description. So the first thing, I don't know if the first thing you did was go bait fishing.
Oh, yeah.
That's the first thing we did. And that was the best fishing I've ever done. we were just catching tons of fish. We were so excited about the bait we were catching. You know, we're like, this is so cool. And then you put these bait on a huge hook. And just like he said, you drop like a 2-pound lead ball, you drop it down to the bottom of the ocean, and you bounce this thing off the bottom of the ocean, like 200 feet down. And then you feel a little tug, and then the work starts. You got to pull this thing up 200 or 300 feet off the bottom of the ocean, and they're monsters. These things are huge fish. You know, and I always loved where we were, you couldn't keep anything bigger than 45 inches. So you're trying to get as close to a 45-inch fish you could, because between 45 and 70 inches, those are the moms and dads who are breeding. You don't want to catch them. And so they wanted to catch littler ones. You know, so you pull this thing up all the way from the bottom of the ocean, it's too big. You're like, oh, geez. But the power of somebody showing you how to do this was incredible. I think as you can learn if somebody will teach you, right? That's the idea. Okay, and then this idea of a positive learning environment, I think is huge. How do you guys try and create a positive learning environment? What can you do to affect the learning environment? Yeah, Morgan.
I know we'll often walk around the students in the reading room, so they get to meet a lot of people and you see that everyone's friendly and not all super introverted weirdos.
Many of us. I love that as a first step, letting them meet people, know who the people are around there. Go ahead.
See how you interact with people.
Yeah.
Making it like a comfortable environment in what you're doing.
Yeah, talking to them. The worst is probably having them sit behind you, never saying a word to them, don't know their name, don't know it. Engage with them a little bit, spend some time talking to them, find out their name. Ways, how are you made to feel comfortable? You probably had experiences where you felt really comfortable in a department or in a rotation or something. You probably had experiences where you did not feel comfortable, right? And kind of contrast those two and realize, hey, you got a learner coming in for the first time. What can you do to make them feel comfortable so that they have a feeling that where they can talk to people, they can learn things. That's what they're there to do. They're there to learn. And a positive learning environment is going to foster that. Other thoughts on a positive learning environment? Yes.
Make sure that they feel comfortable asking you questions, because sometimes they ask me, can I please ask you a question? I was like, you can ask me 100 questions, they pay me for this. That's part of my contract. Ask as questions as you can, to make sure that you're not missing out, you're not scared that they can ask your resident this question. Just make sure to let them know that you can ask as much questions as you want.
Yeah, I think as a teacher, you know that you've created the right environment when they do ask questions, right? So if you got somebody who's not saying a word, they probably don't feel comfortable, do they? But if they're interrupting you, okay, now you don't want too much interruption, right? But if occasionally they interrupt you, you should probably feel pretty good about that. Oh, this person felt comfortable enough to interrupt me to ask a question. Now, there has to be limits, it has to be appropriate and all of those things, but you probably arrived at a positive learning environment if that's the case. I love that. That's really good. Other thoughts on positive learning environment? Some departments struggle with this, right? Some environments, people are, maybe that hasn't been fostered. I always say Sandy Ornstein is my favorite. You guys don't even know him anymore, do you? He was the master at creating a positive learning environment. He really was. People just felt comfortable around him. He talked to people. He made sure he knew their names. And once they feel like they're in a positive learning environment, you can tease people a little bit, and it's okay. Now, I'm not promoting teasing anyone, right? But you've arrived if you feel okay about that, right? That it's not this toxic environment where he said, what? Oh my gosh. But you can have some interactions that are fun. All right. Okay, and this, overall, are they an effective teacher? I think, think about teachers you've had and what they've done to be, and a lot of things that we've talked about, non-judgmental, role model, enthusiasm, availability, all create that positive learning environment. Is it a safe environment? Okay, we want to make sure it's safe for people. And then enthusiasm. I love showing this. Tom Sawyer, although I listened to Tom Sawyer, it was a little offensive. It's like clearly a different generation. But I love the story and the idea of making something that's not pleasant. Here he's painting the fence, and he made it look so fun that other people wanted to join in. I love that concept. Can we even make difficult things enjoyable? And I think when your environment is right, you can do that. We tested it out. I love showing this. We were pulling weeds in our yard with my son, right? So that's not a fun job, right? And he wasn't having any fun. He didn't want to do it. And I said, Randall, we saw his friend Denver come by. We said, Randall, let's try and make this look really fun to see if Denver will come over and pull weeds with us. And so we did it. And sure enough, Denver thought we were having fun, and he came over and started pulling weeds. It does work. You can't even make unpleasant tasks enjoyable if you have the right attitude. Here's my example of that. You radiologists probably know what's going on here. How about you internists? How would you interpret that X-ray? Or surgeons, even better. Surgeons feel bad. What?
That ain't good.
It's not good. Bad. No bueno. Yes, somebody said the word. This is severe impaction, right? This is a large amount of stool in the colon and rectum. Here's a CT. I mean, it's just all full of stool, right? So, disimpaction, not pleasant, right? But sometimes it needs to be done. You can have a bad attitude. You can have a good attitude, right? This is this is a consult needed stat by a GI fellow. Yeah, that's awesome. So here's our students, their first year, lined them all up, took their picture, teach anything, anywhere, take advantage of moments to teach. I think sometimes, giving a long lecture like I'm doing, probably is not the most effective way to teach, right? Just taking small moments where something comes up where you can teach something, I think that's going to have a longer impact than giving a long lecture about a topic. And my example of that is this, right? I'm a pediatric radiologist, look at a lot of head ultrasounds, and obviously we have a big hemorrhage here. And so the question is, what grade hemorrhage is this? And we have the options 1, 2, 3, or 4. So there's blood in the ventricle. It's actually going into the third ventricle here. So what grade hemorrhage would that be? It's an opportunity to teach a concept I think is kind of important. What's the difference between a grade 2 and a grade 3? Grade 2 means there's blood in the ventricle, which we clearly have here. So this is at least a grade 2. Grade 3 means there's so much blood in the ventricle that the blood expands the ventricle. And I think not hard to tell that we have so much blood in here, it's larger than the opposite side. So this would qualify for a grade 3. You should teach a simple concept like that in a moment where it's a case that just pops up. You can teach what the grading system is for germinal matrix hemorrhages. All right, we've talked about a lot of these things already. So we're going to ask for any questions. We did some of this last year, so I mostly wanted to focus on mission and values this year. But we do value what you do as teachers for our students, and we appreciate it. We try to show some appreciation every year by nominating one of you for an award. Not that you have to get an award to feel like you're a good teacher, but we're trying. So any questions about your role as teachers? All right, one more thing I do want to mention, there are clerkship directors, right? And there is a curriculum the students have. It would actually be nice for you to know what they're supposed to learn, right? And that's not fair to you, really, if you have no idea what the student is supposed to learn during their rotation. So how many feel like they know what that is confidently? 0. So there's room for improvement on our side. Make sure that we are getting that information to you on what we expect the students to learn during that rotation. Because I don't think that's fair to be put in a position of having to teach when you don't know what they're supposed to learn. Okay, thank you very much. Happy to answer any questions if you have any.